Welcome once again to the Sad Chad Matrix here. And as you may have seen, if you haven't, check it out, my video with Dr. Tinney on optimal lab reference ranges. But you may be asking a little bit more, but how did we get this? Well, a lot of these are from mortality data that Dr. Thomas Lewis has gone through the literature. He's identified that a lot of these optimal values that we know in functional medicine can actually be backed up if you look at mortality data. So patients with higher or not optimal levels, they die sooner and more often than those with better levels. But what we don't have is optimal levels for hormones. Now, hormone values over the years, the labs have reduced these values time and time again, right? So total testosterone levels, if you ask older doctors, who are still alive, they're 80, 90 years old, they remember when total testosterone levels, like optimal, was like 500 to 1,400. But now the labs will tell us that optimal or the normal reference range is about 290 to about 900. But for me, in my experience, what I found, it's very subjective for patients. What is one optimal, feeling good for one person, is not the same for another. And until you get a patient to optimal levels, they may not even know what optimal is or feeling. So when I have families and they have kids and teenagers, what I recommend for them to do is actually test their teenagers. So when their teenagers are feeling great, they're 16, 18 years old, they can go to Panda Express and they run hard and they don't gain weight. It's because basically they're on anabolic steroids. Their growth hormone is very high. Their IGF-1 is probably sitting around 300 or 400. Their T3 value is like 4. Right? So they have very high metabolism. Their testosterone levels typically are very high as well, pushing anywhere upwards of 800, 900. So I actually recommend teenagers get tested, capture those lab values, know what it feels like to be 16, 18, laminate them, put it in the yearbook so that you have it for your entire lifetime. And that can be your optimal reference ranges. You know what you were when you were young and optimal and feeling great. Then when the 9-to-5 job hits, when you're age 30 and you're gaining weight and you don't feel energetic, you can look back at what you were when you were 16 and you were playing soccer, baseball, and tennis, 3 sports at a time, and eating carbs and having plenty of energy. You can know what it felt like to have those level of hormones. So that can be your optimal, but not everybody has that. So they have to rely off what my experience is and what I've understood is what optimal is. But then we tinker around things. We try to maximize people's values, get them in the top percentile range of what we have identified as optimal, and we see how they feel. And that's how we really identify what optimal is. Yes, it's based off mortality data, but then hormone lab data, there's not so much mortality data on that. So that's a bit more subjective. But if you have a historical trend, or you have family members, maybe you can base it off maybe some of your children's levels. But the best would be to have a trend throughout your entire lifespan of all your lab values and keeping track of them so that you know where you are at optimally. And so that's our take here on the Sad Chad Matrix. Thanks for watching.